Good afternoon, everyone. Thank you for joining us for our webinar series for workforce education on HIPAA compliance, cyber risks, and cybersecurity. We know your time is very limited and valuable, and we really appreciate your participation. Today, we're going to look a little bit deeper into one thing that physician practices must do. Our speakers today are Kassie Toerner. I am a senior risk management representative here at TMLT, and I also work with our products consulting department, conducting risk assessments and doing some basic HIPAA compliance. Our other speaker today is Cathy Bryant.
Good afternoon. I'm Cathy Bryant. I'm the manager of TMLT's Product Development and Consulting Services, and I've been working for several years with physician practices, helping them to improve their HIPAA compliance.
We have a basic disclaimer here for you all that today is a supplemental resource. They are not legal resources. You will also see, or you should see, a Q&A pod available for you. If you have a question, please type it at any time. I know on some of your screens it may be a bit intrusive, so we apologize for that, but we will answer any questions that you have at the end of the presentation. There's that little Q&A pod for you. So our agenda today of what we're going to be covering, which is the one thing that you all have probably heard about, is what is the requirement for a security risk analysis. We'll look at what a security risk analysis is. We'll look at, is it different from a risk assessment? We'll look at why they are important, and we'll look at how do we know if they are thorough and complete according to what the HIPAA security rule puts forth. And then we'll discuss briefly what TMLT offers as far as risk assessments are concerned. So the security risk analysis, the federal law you can see here says that we are to conduct an accurate and thorough assessment of potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity. Every covered entity is required to conduct a risk assessment. Your risk assessment should help you to ensure that you're compliant with the HIPAA's administrative, physical, and technical safeguards. It should also help to reveal areas where your organization's protected health information could be at risk. So this is why we are going to look at the security risk analysis today. So again, the first part of the HIPAA security rule, the standard, says that a risk analysis must be first implemented. We'll talk more about this in greater detail. There is no single method or best practice that guarantees your HIPAA compliance, but most risk analysis and risk management processes have steps in common, and we will discuss these in greater detail later in the presentation. A couple of things to keep in mind. Your security risk analysis, it's not optional, even if you're a solo practice or even if you're a small practice or even if you may only be doing paper documentation. There could potentially be other areas that you are held to do this security risk assessment. So here, the risk assessment versus a risk analysis, the SRA, are those different? And there are a lot of words here, and there's a link for you at the bottom of this page, but basically, no, they are not different. This is just a semantics issue. When these rules first came out, it was called a risk assessment, and now it's called a security risk analysis. So if you see those words, they are interchangeable, and they basically mean the same thing. One thing that we wanted to point out to you guys is that in almost 100% of OCR investigations, covered entities fail to conduct a thorough and complete security risk analysis or implement a risk management plan. Their director of the OCR, Roger Severino, said the number of breaches involving a variety of locations and vulnerabilities highlights why there is no substitute for enterprise-wide analysis for a covered entity. So from the OCR's perspective, it is very critical that you conduct your security risk analysis. Also, if they were to investigate you for some reason, the first thing that they're most likely going to ask for is your security risk analysis. So you want to make sure you have that available for the OCR if they were to ask you. So at this time, we would like to ask you a little polling question here, if you guys would take a second and answer these questions. This question: how often do you do a security risk assessment? Annually, every 2 years, only after reportable breaches, or NA? Looks like the,
It
yeah, go
looks
ahead,
like
Kathy.
it looks like the majority are doing a security risk analysis annually, and that is great. Uh, Cyber attorneys recommend at least every 2 years, so good job to everyone who's doing it annually. The federal government has published many resources related uh, to security risk analysis to help us understand what a security risk analysis or security risk assessment is. Um, and we have those resources listed on your screen. The security risk assessment or risk analysis, and we'll probably use those terms interchangeably. Uh, the first really widely published document is the Hipaa Security Series number 6. It was originally published in 2005 when the security rule first became effective. It has been only revised one time, but remains a great resource. I find it interesting that despite all the changes in technology, especially in healthcare technology since 2005, the HIPAA security rule has never changed. That's why cybersecurity experts often refer to HIPAA security as a baseline and not a total answer to cybersecurity. There are two more resources listed. The first one is a 2018 OCR white paper, the risk analyses versus gap analysis, that was published by the Health and Human Services. And we're going to delve into this one in just a moment. But the other is just the HHS website. They've really tried in recent times to get the majority of their information moved into this security page very quickly. So regardless of the resource, you will find commonalities. The HIPAA security risk analysis is a process used to identify potential security risks and determining the probability of their occurrence and the magnitude of the impact on the organization should they happen. So let's take a closer look at that 2018 white paper. So basically, the OCR has identified in audits, breaches, and complaint investigations that organizations struggle to conduct a thorough and complete security risk analysis. The 2018 guidance was designed to show organizations the greatest area of confusion, that being a security risk analysis is different from a gap analysis. The goal of HHS was to help us all understand that a risk analysis must be a comprehensive review of all of the locations that organizations create, maintain, receive, and transfer electronic protected health information, and the impact that the risk carries if they occur in your organization. This is in contrast to a gap analysis. The gap analysis compares a set of standards, or in this case, the HIPAA security rule, against your organization's written policies and procedures. It's a high-level overview of how your entity's safeguards are implemented, and it shows whether it is incomplete or missing. Let's keep diving in a little deeper. This is an example of a screenshot of a very small part of the online security risk analysis report that can be done with the HHS SRA, or Security Risk Analysis online tool. In this case, the threat is an inadequate risk analysis, or the threat is inadequate risk awareness or failure to identify new weaknesses. The first vulnerability shown is the non-physical threats, such as data corruption, information disclosure, interruption or system function, or business processes and/or regulation of security breaches, is low. This finding may be due to the organization's high level of security and having a continuous backup. In the second example, the physical threats, such as unauthorized facility access, hardware or equipment malfunction, collisions, fire, trip hazards, and other hazardous materials, is rated as critical. This may have been based on the findings, such as the server room or closet was located by the unlocked back door in an unmonitored area, and there perhaps was no lock on the server room door. Another finding is that the server was sitting on the floor in the same room where bulk cleaning supplies are stored. Imagine if a chemical, such as a cleaning chemical, were spilled on a server. Liquids and servers do not mix very well. By comparison, this is a chart of a gap analysis. It lists the Hipaa regulation, and then it asks two questions. Does the organization have written policies and procedures that address the regulation? And secondly, has the organization implemented the procedures? Then a compliance rating is assigned based on how the organization is meeting the regulation. Basically, the gap analysis is looking at your administrative functions within the organization, your policies and procedures, and not looking at your network security.
So why is a security risk analysis important? Well, as we've already mentioned, it is a federal law. All providers are required to perform a risk analysis. Taking it one step more beyond that, to comply with Hipaa, you must continue to review, correct, or modify and update your security protections that you identify in your risk assessment. Again, the director, Roger Savino, says the OCR is very serious about protecting health information privacy and will pursue litigation if necessary to hold entities responsible for Hipaa violations. Secondly, it also gives you a baseline of cybersecurity for your practice. The purpose of this security risk analysis is not simply to comply with the government, but it's also to identify security weaknesses within your organization. In doing so, you can hopefully strengthen your security and ultimately avoid potential breaches, saving you from potentially disastrous financial or PR or regulatory issues. You also are going to be protecting the patient's data in a more strong manner by knowing where your vulnerabilities may lie. And then reputation management. These security risk assessments could help you to avoid a breach, which also ties into cost. If you can avoid these breaches by identifying and addressing those weaknesses early on, you may be able to save yourself from future costs associated with failed technology or systems, bad actors, and government fines. A breach can be very costly. IBM found that breaches within healthcare are 2.5 times the global average across other industries. So we see that with healthcare, those costs can be very expensive. So if we can avoid that by conducting the security risk analysis early on and identifying the weaknesses and then working to mitigate those areas of those threats and vulnerabilities.
So, since the majority of you are doing annual security risk assessments, how do you know if your risk assessment is thorough and complete? The 8 steps listed here are items we see OCR investigators looking for when they evaluate a risk assessment submitted to them during either a breach investigation, a complaint investigation, or an audit. Let's look at each one closer.
So the first thing that we will do is identify the scope of the assessment, defining how to meet the requirement of an enterprise-wide risk assessment. The key here is when you look at your assessment, you want to look at people, processes, and technology that create, receive, maintain, or transmit ePHI. So your staff members, phone calls, appointments, visits, check-in, personal devices that you allow your staff to bring. There's a long list of things here, but you want to, again, assess people, processes, and technology within your healthcare organization. The key here is to not just focus on your EHR, your electronic health record, because there are so many other variables that fall into the security risk assessment. The second thing is that you're going to look at gathering data on the practices, processes, software, equipment, again, that create, receive, maintain, and or transmit protected health information. Again, we want to think outside of just the EHR, and we want to make a list of all the people and the processes and technology that create, receive, maintain, or transmit ePHI. Again, we're looking at even floppy disks in this day and age. We still see those that have ePHI on them, flash drives, thumb drives, monitors, phones, tablets, phones that staff are bringing in. If you have any equipment such as x-rays, MRIs, sonogram, pulmonary function testing, just all of those are items that you'll want to think about as you collect a list and inventory all of the places where ePHI lives in your healthcare organization. Ileana Peters, the attorney and former OCR investigator, said if a HIPAA covered entity or business associate does not identify all the places where ePHI lives, then it cannot sufficiently protect ePHI against threats or exploitations or vulnerabilities. So really, again, the goal is to identify all of your areas so that hopefully you can prevent any threat or attack by being able to recognize those at the outset. And again, like we said, not just devices managed by your IT support team. We would, encourage you to think bigger and staff, people, processes, and technology across your entire organization.
So the third step is to identify and document potential threats and vulnerabilities. Did the assessment identify and document threats, which are the potential for a person or thing to exercise, either accidentally or intentionally, a specific vulnerability? These are often ranked as natural, human, or environmental, as opposed to vulnerabilities, which are flaws or weaknesses in a system's security procedures, design, implementation, or internal controls. Again, when they're triggered either accidentally or intentionally, they can result in a security breach or a violation of your security policies. Often, threats and vulnerabilities are represented in a table format in a risk analysis. I believe the fourth step is perhaps one of the most important steps in the security risk analysis. And that's just personal opinion. I'm not speaking for the OCR. It looks at what you're doing proactively to help protect your data from unauthorized use and disclosure from both a technical and a non-technical point of view. I frequently get asked the question, is it okay for my IT vendor to do the security risk assessment? And the answer I give is there is nothing in the Hipaa security rule that says who can or cannot do the SRA. However, if your IT people are providing your security management processes, are they going to tell you if they're not doing something they should be doing? Or conversely, do they see this as a way to sell you a new enterprise-wide firewall at a cost of, say, $25,000? We're going to look at steps 5 and 6 together. We're going to go back to the chart that lists the threat of inadequate cybersecurity or IT training with a vulnerability of social engineering attacks or email phishing attacks. Once the assessor has identified the threats and vulnerabilities, they must determine the likelihood that something is going to happen within your organization and the impact that it would have. So if you look at the vulnerability of a social engineering attack or email phishing attack, the likelihood of that happening within an organization is very high. And the impact is also rated as very high. That's often because that phishing attack may be actually the way that malware is being introduced into your system, your network, and that could represent a ransomware attack. Sometimes it's presented as a numeric value, and in this case we've chosen the example of 9 and 9, again on a scale of 10 to represent a very high level of impact. The 7th step is to determine the level of risk. Risk is a function of simply determining the likelihood of a given threat being triggered or exploited and the resulting impact. The risk ranking is determined by using the findings of likelihood and impact and multiplying them together. If using the numeric value, the scores would simply be multiplied, in this case 81. They can also easily be converted to a color-coded type of ranking that is very easy to help management to see which topics are most critical in need of immediate remediation.
And the final step, as with all things healthcare, is to document all of your efforts that you are putting forth in your security risk assessment. If you maintain your report online, we would recommend that you ensure it is backed up, as the OCR requires you to maintain documentation of your risk analysis for a minimum of 7 years. So take credit for your efforts, make sure that those are available. Document emails that you may send out as security reminders or meeting minutes that you have from reminding staff or training. Keep those all in a secure place so that you can take credit for the efforts that you've put forth from your security risk assessment. So what's next after you have completed your security risk analysis? Your risk management plan is what you will develop. As we mentioned, these findings that you find from your risk analysis will be an ongoing process, and you will use the things that you've identified to develop your risk management plan. So once your SRA is complete, you must also continue working to reduce the risk that you have identified through your risk assessment. There is no frequency that the security rule prescribes for performing a risk analysis. We discussed earlier, most of you all are doing it annually, some every 2 years. But again, it's an ongoing process that you'll want to integrate into your business processes to ensure that the risks you've identified have been addressed in a timely manner.
So does TMLT offer risk assessments? Yes. We've been doing risk assessments, in fact, since 2013. Our risk management department initially identified during practice reviews that practices were struggling to meet the challenges of both Hipaa and the Texas Medical Privacy Act. When we began to look at risk assessments, we wanted to offer options to practices because we know not all practices are created equally or have the same resources. So from a security risk analysis on the low side that simply looks at the security rule, we can offer that very basic requirement or meet that basic requirement. We can also do a comprehensive assessment of compliance with the privacy rule, the security rule, the breach notification rule, and state laws or Texas laws. I think this would be a good time to ask a quick polling question. See if I can get it expanded. So the question is, describe how you meet the requirement for the security risk assessment. I'll give you a couple of seconds to answer that. It looks like the majority are doing self-assessments, which is a good option. And the best is that I see that no practices have not ever done a risk assessment, so that's great. It's important whoever does the security risk assessment to make sure that it is addressing all of the people, processes, and technology within your organization. And yes, it's sounding like a repetitive statement. Organizationally, you should have a comprehensive risk management plan. It not only addresses Hipaa compliance, the parts shown in the pyramid, but it should address risk transfer. Risk transfer is your cyber insurance. It is your organization's safety net when something bad happens, despite all the hard work you've done. We know that the cyber criminals are working 24 hours a day, 7 days a week to try to get into our networks and disturb your practices. So the biggest thing that we would like you to know is that you have cyber insurance. You perhaps have cyber insurance, but is it adequate? Is it enough?
And in closing, the one thing that we recommend physician practices do right at this time is to conduct a risk assessment or a risk analysis. You can use the 7 steps to develop a framework to develop your risk assessment and your risk management plan, develop your scope, gather your data, identify your vulnerabilities and risk, assess your security measures, determine the likelihood of threat, the impact of the threat, and the level of the threat, and then document all of those efforts that you have made. And again, as a reminder, we apologize for it feeling very redundant, but again, taking a holistic approach and considering all of your people, processes, and technology within your organization, whether it be verbal, paper, electronic, considering all of those aspects of your healthcare organization so that you can identify any vulnerabilities or any weaknesses. And this will conclude our presentation. We do welcome your questions and feedback. You can submit those in the chat pod that is being put up on the screen. Or if you would like, you can also send an email to us at consulting@TMLT. As a reminder, those files are there for your convenience if you would like to download the presentations. I see some questions there that say, are the slides available? They are there in that file pod. You're welcome to download those and use them as you see fit. And again, we just appreciate your attention and your participation today. Thank you so much.
We know that some of you may need to drop off, but we'll stay on and continue answering the questions. There is a question about a certificate of attendance. If you have a specific need for a certificate of attendance, feel free to email the consulting@TMLT and we'll be happy to provide one. You will get an email in follow-up tomorrow with a link to the recorded presentation, and that may also be sufficient to show that you have attended the presentation. I have a question about the cost of the comprehensive risk analysis by TMLT. The cost of our base security risk analysis or risk assessment is $2,500 plus expenses. There are variations on that depending on if you have multiple sites that we need to go to, the size of the organization. But again, we can be reached at consulting@TMLT and answer your specific needs, talk to you specifically about the questions that you may have. I have another question about when working with the SRA, should we be defining a score standard in our policy, or does CMS have a requirement? For example, high, medium, and low, what should we consider that to be numerically? In the Hipaa Security Series number 6, they describe two methods of scoring, a quantitative and a qualitative method. And I think if you look at those definitions, you'll get a pretty good idea that there's not a required standard. And I have seen risk assessments that have been scored on the high, medium, low. I've seen risk assessments that score on a 0 to 5, a 0 to 10. They vary depending on the organization and the methodology that they're using. Any other questions? Again, you'll have a email tomorrow with the slides attached, and if there's anything that comes up in questions later, the consulting@TMLT is a great email for you to save and send questions into at any time. Cassie, any closing thoughts?
No, none at this time. Again, we just thank you for your participation and feel free to email us any questions that you may have regarding HIPAA, cyber risk, cybersecurity, or compliance.
Y'all have a great afternoon.
Thank you.